Hello, everyone. I hope you are enjoying the Virtual Institute. Today, I'm going to be talking about our research project titled Mental Health and Wellness for Patients and Healthcare Workers After a Medical Error, a patient-oriented research. I am Fabiola Diaz Carvallo, an MSc Clinical Epidemiology candidate at the University of Alberta. The only thing I need to disclose is that the Canadian Patient Safety Institute funded this research project. I have only a few minutes to present, so I will give you a very brief overview of our study and provide just a few highlights of what we have found so far. I don't know if any of you listening to this presentation have experienced what it is like for you or a family member, your child, your mother, your spouse to be harmed by a medical error. But I'm sure you can imagine how traumatic and emotionally painful this would be. You might also be able to imagine how difficult this might be for any of the healthcare workers involved who might feel incredible shame and guilt for what happened. Helping both the patients and the healthcare workers with these experiences is what motivates us in our research. Our research team includes patients and healthcare workers who are bringing their experience and expertise to the planning and implementation of our study. This research was initiated after conversations with a patient about her personal experience with a medical error that unfortunately resulted in her mother's death. She and the pharmacist who felt responsible for the error met 4 years after the incident. It was a tremendously valuable meeting. They both maintained they only began to heal emotionally when they met each other. From this powerful story, we created a research project to explore whether informal, purposeful conversations can help both the healthcare workers and the patient or families heal after a medical error. Okay, now I want to clarify what we mean by mutual healing. Mutual healing is a support program that incorporates purposeful conversations between patients and or families and healthcare workers after a medical error, which might promote healing and wellness for both parties. Now, let's dive into the methods. Our study is based on constructivist grounded theory and a patient-oriented research approach. Our study includes 3 phases. Phase 1, also divided in 3 sections: literature review, consultation with team members, interviews with experts in the field of patient safety, medical error, and patient healthcare worker communications. Phase 2, data collection drawn from the participants' stories and thoughts about their own experiences after a medical error. Phase 3, we will analyze the data to explore the circumstances where purposeful conversations between healthcare workers and patients are most valuable and effective. What are we at today? We have completed phase 1, and today I will be presenting you the results from this work, highlighting the key findings. Let's move on to the literature review findings and discussion. We did not discover studies specifically focused on mutual healing, conversations between healthcare workers and patients following a medical error. However, there was a significant amount of information that could support a program that would help promote wellness and healing in healthcare workers and patients after a medical error in the form of study results, incidental findings, testimonials, and editorial comments. Now, I want to mention the key findings. So we had 6 different key findings, and I'm just going to review them next. First, let's talk about the impact of medical errors on healthcare workers and patients. It is well established in the literature that medical errors can have a significant impact on healthcare workers and patients. When patients are harmed by medical errors, they can be severely traumatized and be left with prolonged emotional, psychological, and financial harm. Patients and families talk openly about feeling isolated after the harm, especially if they are shut out of meetings and discussions with those who were directly involved. The impact on healthcare workers. One author compares the impact of a medical error on a healthcare worker as a psychological earthquake. Another study found that after a medical error, the healthcare worker often feels upset, guilty, shameful, disappointed in themselves, fearful of the outcome, anxious, lost, and alone. What are the benefits of open communication? During a personal conversation with Susan Scott, the patient safety coordinator of the University of Missouri, she said, "Healing happens when patients and healthcare workers unite. It is a sacred space where they can see each other as equals, just people talking to each other about their emotions and how the incident affected their life." This is a very touching example of a patient and a healthcare worker who felt responsible for the incident, got together and healed. I know this is a very busy slide, however, it is very impactful and I will go through it with you. The patient says, I wanted to let him know that this impacted me emotionally, and I also wanted to know how he was doing because his training has shut him down from feeling. For me, the most powerful part of this conversation was when she offered me forgiveness. It still sends chills down my spine. I just remember that because it was a relief. I felt I had my life back. This encounter was just two people healing from an event. Another example of a successful encounter from John's perspective. This was one human reaching out to another human in compassion, humility, and grace to attempt to right a wrong and bring healing to all. Okay, now I want to talk about apology and forgiveness. As you can imagine, patients are looking for an apology. Patients are hoping that someone will say sorry. An apology is considered to be an indicator that the medical error is being taken seriously, and actions will be taken to avoid the medical error from occurring again in the future. It is important to remember that patients might initially not be open to the apology and might experience anger, and this is okay because they're in their healing journey and it should be respected. A mutual healing conversation might also lay the groundwork for forgiveness. An apology provides an opportunity for the patient to offer forgiveness. Since an apology and displaying empathy helped lead one to forgiveness. Our research uncovered a number of processes or programs that, although they are not focusing on mutual healing, they might incidentally promote healing and wellness. We will not be reviewing them today because, as I stated before, they are not focusing in mutual healing itself. In regards to the barriers and challenges, Dr. Leib, professor at the University of Harvard University, he said, at the time when the patient needs us the most, it's right when we are the least prepared. The other major barrier that is often identified when medical errors conversations are discussed is the fear that healthcare institutions and healthcare workers have of litigation, and also the shame and vulnerability the incident might generate. Lastly, the summary. The academic and gray literature review gave credence to our hypothesis. We identified a number of programs and processes designed to resolve issues between patients and healthcare workers after a medical error. We also uncovered value information about apology, forgiveness, and the value of open communication. The experts we interviewed as part of our great literature review fully endorse our efforts. Thank you very much for listening to our research project presentation today. Please, if you have any questions or concerns, contact me at the email account shown in this slide. Thank you again. Have a great day.